Trinity Mother Frances is recognized for many of their services throughout our community, but most recently they've won an award for their cardiac arrest treatment. So joining us in the living room is one of these prestigious doctors. Good morning.
Hello.
Good morning. Thank you.
So first and foremost, tell us about this award.
Well, the award is given by the Society of Thoracic Surgeons, and we submit data on all cardiac cases that are done at Mother Frances. So anybody who has heart surgery, such as bypass or valves, we collect data on and submit it. The Society reviews that data and then ranks the programs that have submitted. About 12 to 15% of the programs in the country will get a 3-star rating. Unfortunately, during this last reporting period, which was 2014, we were in that group.
Oh, wow.
Wow, and it's been 6 times. Has that been within 10 years or 15 or 20?
That's over about the last 7, 8 years that we've been reporting.
Wow.
We've gotten the award 6 times.
Wow. So what does this mean to you? Because you've been a part of this organization this entire time.
Well, what it means to me is that we've got an outstanding team of people who help us achieve these results. We wouldn't get a result like this with just a surgeon or one individual. Everyone in the team, from nursing staff to anesthesiologists, surgeons, subspecialists who help us care for these patients, really deserve the award because they do a great job.
Yeah, you guys do.
Yeah, it really speaks to that dedication to heart service. What about now, back it seems like many years ago, perhaps, maybe around the area, people would say, well, I have to go to Dallas for a procedure, or I have to go to Houston, one of the bigger medical centers. From your experience here, obviously, people don't need to do that now.
Mm-hmm.
That's true. Short of heart transplant, we can do just about any procedure that you can get done in Dallas or Houston here in Tyler. We've got a team of 3 surgeons. We're sort of leaders in robotic cardiac surgery, minimally invasive surgery, and in traditional approaches for valves or valve coronary cases. So we really can provide all that care right here in Tyler.
That's wonderful. So are any of those things involved in the criteria that are used to give this award out?
Well, there's 4 categories of data that we collect. Morbidities, which are patients who die after the surgery, mortalities, complications, and then surgical technique. And those 4 criteria are used to generate a composite score, and that's where the star rating comes in.
Got it.
So I know that there's the term, maybe just to clarify for those at home, you have the term open heart surgery now. Is that necessarily bypass, or is that encompass just all of those? Or?
Yeah, the term is kind of general, open heart. It would include any kind of operation on the heart, valve surgery or bypass surgery or some other procedures that we do less commonly. So that's kind of the general term. But many of the valve surgeries we do now, we don't need the traditional open incision that people think of. We can do it through a keyhole, about a 1.5 inch incision on the chest. So we don't have to open people's chest many times to do some of the surgeries. Even the robotic coronary surgery we do, we can sometimes do bypass surgery now through some small port incisions.
Wow, that's great.
Wow.
So other than that tinier scar, what else does this mean for patients?
Well, quicker recovery, obviously back to functioning and a lot faster than they would with a traditional incision, lower complication rate, less pain, just a better experience overall.
That's fabulous.
Wow, I just remember back in the day, my grandfather had it back in the 80s and talked about using the saw to get in there. So obviously now it makes much sense to have a smaller...
Better than ever.
with cameras and robots and special lighting, we can see through a very small incision.
That's wonderful. And is there anywhere people can go to take a better look at this award or find you guys online?
Absolutely. Our data is reported publicly. They can go to the STS website, Society of Thoracic Surgeons. That data is also available on Consumer Reports, and they can look at different programs. And of course, our website at Mother Frances has details.
Okay, perfect. Well, thank you so much for joining us, and congratulations.
Oh, thank you very much.
So coming up next on